The adult brain needs 3/4 of a litre of oxygenated blood every minute. Blood is the principal source of glucose, the only sugar that the brain can metabolize. And since carbohydrate storage in the brain is minimal, supply must be constant. The blood supply of the brain is derived from the internal carotid and vertebral arteries. The internal carotids enter the skull through the carotid canals in the temporal bones and run forwards through the cavernous sinus. They pierce the dural covering of the brain medial to the anterior clinoid processes. After doubling back for a short way in front of the anterior perforated substance, each artery ends by dividing into middle and anterior cerebral arteries. The anterior cerebral arteries, connected by the anterior communicating artery, enter the longitudinal fissure. Each curves backwards over the corpus callosum and anastomoses with the posterior cerebral artery. Cortical branches of the anterior cerebral arteries supply the medial parts of the frontal and parietal lobes, and a small area around the parieto-occipital sulcus, the motor area for the leg. Central branches help supply the basal ganglia and internal capsule. The middle cerebral arteries, the largest branches of the internal carotid arteries, enter the lateral fissure. Cortical branches supply the undersurface of the frontal lobe, the insula, and much of the lateral surfaces of the hemispheres, and therefore much of the motor cortex, except the leg area, and much of the auditory and association cortex. Central branches supply the basal ganglia and internal capsule. The vertebral arteries enter the skull through the foramen magnum and ascend over the anterior aspect of the medulla. The largest branches, the posterior inferior cerebellar arteries, supply the vermis, the inferior surface, and the central nuclei of the cerebellum. At the lower border of the pons, the vertebral arteries unite to form the basilar artery. It has a number of branches, including the anterior, inferior, and superior cerebellar arteries which supply the cerebellum. After ascending in the basilar groove, the basilar artery divides into the posterior cerebral arteries which run laterally between the midbrain and the temporal lobe. Cortical branches of the posterior cerebral artery supply the inferolateral and medial surfaces of the temporal lobe and the lateral and medial surfaces of the occipital lobe. The internal carotid and vertebral arteries anastomose at the base of the brain through their anterior cerebral, anterior communicating, posterior cerebral, and posterior communicating branches. They form the circle of Willis. Normally, there is little mixing of blood from different arteries within the circle. However, when a vessel is blocked, here by atheroma, it is possible for blood from the internal carotid, for example, to supply the posterior pole of the brain, or for the left vertebral artery to supply the right side of the brain. In practice, the anastomoses function poorly, and most of the branches of the circle of Willis are functionally end arteries. Blood leaves the brain in thin-walled valveless vessels which cross the subarachnoid space and drain into the venous sinuses. The spinal cord is supplied by a rich network of arteries. The anterior and posterior spinal arteries are derived from the vertebral arteries. The anterior vessels supply the anterior 2/3 of the cord, and the posterior vessels most of the remainder. Branches of local vertebral, deep cervical, intercostal, and lumbar arteries, called radicular arteries, enter the spinal canal through the intervertebral foramina.